Thank you for the invitation to join this conversation. I think, Professor Pai, thank you for just illustrating just how deep the real strain is we have at the moment in the global health landscape, with the deep funding cuts, the geopolitical uncertainty, and some really fundamental questions about how a health system is organized, whose priorities shape it, and how sustainable it is. And I can't attempt to answer those questions. And what I'll do instead is reflect on Wellcome, how we are, if you like, trying to embed principles, really coming from our equity framework and equity approach, but really seeing how we can approach those principles and some of the practical ways that comes through. And then I'd like to talk about one of the ways in which we're engaging with the global health landscape at the moment, because I think it might echo that sentiment and hope, I think, that Dr. Pai spoke about. And then just to conclude, how we might engage on the principles of solidarity. So for those that might be less familiar with Wellcome, Wellcome's an independent global philanthropy. So our mandate is around improving health for all through science. And our role, therefore, in the health system is quite particular. We're not implementers and we're not government. We have funding, independence, and we're able to work catalytically. So it means that, where we can work, our contribution is less about scale and recognizing that no single funder or organization can currently step into the gaps that we're facing in the global health financing. It's more about how we can support knowledge and institutions and partnerships. And that's what our strategy and approach is about, combining research, influence, and engagement. We work globally with a particular focus in the UK and in lower middle income countries in Africa, South and Southeast Asia. We have a new equity framework and actually underpinned by a new department, which is working right across everything that Wellcome is doing. And that really asks us to pay attention to who's leading the science that we fund, who is able to participate, and who ultimately is benefiting from it. So across our portfolio, we're increasingly attentive to questions of legitimacy and effectiveness, including the equity of the research ecosystem itself. So whether knowledge is trusted and usable and relevant in its context, whether decision-making, leadership, and capabilities sit where the impact is intended, whether communities and partners can participate meaningfully rather than tokenistically, and whether the benefits of research flow to those whose lives is meant to improve. So what does that mean in the practice of what we do? And again, I'm just going to echo, we don't have the answers to everything, and we certainly are in a learning space and keen to reflect on how we are working. So we fund in discovery research because it's foundational to the progress in health and futures. But we also work in solutions type research on urgent health challenges from mental health, infectious diseases, and climate and health. And that's where we very much connect the research with policy engagement partnerships, and community engagement in many, many forms, including those with lived experience. Really so that we can take that research into evidence that can be more effectively put into use. And across all of what we're doing and the grants that we work with, we're paying very close attention to how we're engaging people and communities, recognizing that it will only have impact when it's relevant in its context and it's trusted by those whose lives it's seeking to improve. So hopefully you'll see those principles coming through in the very practical way in which Wellcome grants funding, the guidance that's embedded on equitable partnerships, on community engagements, and on an enabling research culture. The equity framework that we have is also asking us to look more broadly beyond the grants to equitable research ecosystems. And that really means that in practice, this is investing more in collaborative approaches, shared platforms, connections across geographies and in networks, not as ends in themselves, but as ways in strengthening the links between the science and the ecosystem and change. And just some practical examples of that. We work in Africa and Southeast Asia and India with funders who are based in those regions, really so that the decisions on the priorities are not taken, if you like, by Wellcome sitting in London, but actually that those decisions and the priorities are informed locally, and that therefore the priorities of those regions are being reflected. We also increasingly work with others through partnerships and platforms, not because projects are not important, because quite often working with others are better suited to sustainability, shaping agendas and supporting collective work. And I'll give an example of that. Wellcome has just recently joined an initiative that works with the science granting councils in Africa around their priorities. So this is a way in which we're looking to the future of science investment by governments and how we partner with that. So really, just to give you the example about an area of work that Wellcome is really engaging with, which I think speaks to this question of solidarity and particularly the challenges of the global health system. And that's in the follow-up to the Lusaka agenda. And here, Wellcome has, if you like, as a philanthropic funder, has been supporting regional dialogues around what is the way forward given the crisis that we're looking at in the global health system. And so across the regions where we have convened these meetings as a shared space for others, particularly country and regional leaders, to try and surface what needs to change, what needs to be protected, and what different actors can contribute to this. We hope that we've used that convening to make sure that we have connected and amplified the voices of communities into that for us, so that, if you like, we really are trying to connect and identify how to move forward. And this is about how, if you like, the system needs to respond to the global south, how agendas need to be set by countries, be regionally connected, and then supported through an enabling global system. The whole agenda, of course, as we start to talk to others, means that we also have to ask questions of ourselves internally about our own practices, our incentives, and how we live up to those principles as we go forward. So we're coming to this conversation on solidarity, wanting to engage and to learn and play our part as a funder in this system. And there are some of the solidarity principles which really resonate, I think, well with that. How do we come to that as a funder? In the principles, Caesar, that you've outlined, and it says solidarity arises against the background of and is then maintained by trust, understood as the confidence to rely on one another across unequal positions with a specific common goal. And it involves us trusting all actors to do their part by recognizing that responsibilities differ over context and time, but actually it's that coming together with trust that we need to work through. So thank you for the opportunity to engage in the conversation, to reflect on our own practices, but also to see in what ways we might join in the allyship I think Professor Pai talked about in taking forward the global health system.